Every nurse remembers the first time they hear the silence. It is not a normal silence. It is the heavy, suffocating quiet that fills a hospital room the exact second a heart monitor is turned off, and the flatline alarm finally stops screaming. The doctor pronounces the time of death, packs up their clipboard, and walks out. The family is escorted to a private waiting room. The door clicks shut, and suddenly you are left entirely alone in the room with what remains. In the hospital directory, this next step is coldly listed as clinical post-mortem care. But on the night shift, behind closed doors, it is known as something else entirely. It is the ghost protocol. An ancient, unspoken ritual passed down from one generation of bedside nurses to the next. In this exact moment, your role undergoes a terrifying psychological shift. Just 10 minutes ago, you were fighting for a life. You were pushing medications, tracking vitals, and adjusting oxygen lines. Now, you are no longer treating a patient. You are preparing a body. And you are racing against biology. The human body begins to change almost immediately after the final breath. If you do not act quickly, nature takes over. The first step of the protocol is an eerie race against time. You must immediately elevate the head of the bed. If you don't, the blood will pool in the face, causing a permanent dark discoloration known as livor mortis. Next, you must use your gloved fingertips to gently press the patient's eyelids down, holding them shut for several long seconds. If you wait too long, rigor mortis will lock the muscles, leaving the eyes frozen open in a permanent, lifeless stare. Then comes the jaw. When life leaves the body, the muscles relax completely, causing the mouth to fall open. To fix this, nurses use an unwritten textbook trick. We tightly roll up a standard hospital towel, wedge it firmly beneath the chin, and prop the jaw shut until the tissue stiffens into place. It is mechanical. It is cold, and it is deeply surreal. You begin to remove the machinery of medicine. You pull out the IV lines, slide out the urinary catheters, and peel away the continuous cardiac patches. You wash the body with warm water and soap, wiping away the sweat of the final struggle. You comb their hair. You put on a clean gown. But if you stand outside that door and listen closely, you will hear something strange. Nurses talk to the dead. Alone in the dim light of the room, as we wash a cold hand or turn the heavy weight of the torso, we speak softly into the emptiness. We say things like, "I am just going to turn you over now," or "Let's get you cleaned up," or "You are safe now. We don't do this because we are crazy. We do this because the human brain cannot instantly process the sudden, violent transition from a living person to an empty vessel. We speak to the silence because acknowledging that no one is listening is a reality too heavy to bear." Finally, you open the plastic shroud kit. Inside are the tools of finality. A white plastic body bag and 2 small cardboard identification tags. You write out their name, their medical record number, and the exact minute their life ended. You tie the first tag around the large toe of their left foot. With the help of a colleague who has walked into the room without speaking a word, you lift the body into the shroud. You pull the heavy plastic zipper up over the chest, over the face, closing out the light of the ward forever. You tie the second tag to the outside of the zipper. The protocol is complete. When the transport team arrives with the concealed morgue stretcher, you wheel the body out through the service elevators, hidden away from the sight of other patients. And when you walk back into that empty room, you don't get time to process what just happened. Housekeeping is already on their way to sanitize the mattress. There is a critical admission waiting in the emergency department. Within an hour, a new patient will be lying in that exact same bed, hooking up to the exact same monitors, completely unaware of the ghost protocol that took place on the sheets beneath them just moments before. This is the relentless, unseen rhythm of the hospital. The most profound transitions of human existence, life and death, handled in absolute silence, away from the headlines by the people standing at the bedside. It is a psychological weight that few outside of medicine will ever truly comprehend. If you want to continue uncovering the deep psychology, the unwritten rules, and the hidden realities of the hospital ward, hit subscribe. Join our community as we look past the cold data of the monitors to understand what it really means to care. Take care of your patients, and take care of each other.